seeing with COVID a glimpse of society where something which wouldn't have happened without COVID did. And because of your situation with the amputation and because of the MRSA, we've had home care workers since September of last year coming in. And I have loved these workers. They fit right in. They know that the idea is that they fit into the home. They don't try to turn the home into a hospital. They're always extremely accommodating. You have all these books here. They almost have no place to put their equipment, but they go, no problem. I don't have to. Some of them sit on the floor. So and then they've told me that in the last 6 or 7 months in Champaign County, there's been hundreds of new home care workers, and that they're always looking for home care workers. And these home care workers go, some of them drive 2-3 hours to get from place to place. So this was making me think that maybe we're seeing a return, and it may be a permanent return, to the house being the site of care and not the hospital. We've talked about the boredom of hospitals, how there isn't any goal except just sitting there and waiting for your test or your operation. There's no sense of people having a purpose in a hospital. The institutionalization, or nursing homes, the institutionalization. We're seeing people who have been uprooted from their home, taken into another place where they don't even belong, and you'll see one lone picture of their husband. Surely we can do better. And so I'm curious what our viewers think about home care, house calls. When our hospital is open, Patch, will we be doing house calls?
Absolutely. I mean, with our students, because there will definitely be students at our hospital, and there'll be people who are already in practice, doctors and nurses coming to see this radical approach to free medicine, and they will themselves, I think, spark up on making a house call, where they might go as an observer the first time, but the next thing you know, you're having a discussion after the house call. And I would encourage them to say, well, why don't you next time bring that up? And you can learn so much more about a person, no matter how deep your interview is with them, if you visit their home. Mm-hmm. If you invite yourself to dinner, then you're really getting a bonus. And I did all those things. Mm-hmm.
Yeah, and I'm wondering, the justification for house calls, I think, was it's more efficient if the patients are lined up in one location and the doctor walks through, rather than the doctor or nurse going to the individual site. How would either of you or both of you respond to that? You know, it's obviously it takes time to do house calls, and you can see 8 patients in an hour if it's a hospital ward.
Well, I learned early on it wasn't how many patients you saw, but the quality of time that you had with them. And if you're just seeing people in a clinic where the boring hallway that they're sitting in, next patient, 8 minutes, you get such a skeleton look at a person that they're not really a person. Where if you're in their house, you see how their spouse interacts with them, the children interact, what kind of photos do they have around? Are the ashtrays full of cigarettes? I mean, there are just so many things you can learn. And if you are observant, and I was a big Sherlock Holmes fan, that you can find out a lot and seek a lot of directions of where the interview goes.
Emmett, what do you think? Do you think that you'd be more useful if you were seeing 6 people in one facility rather than going to this one guy's house?
Well, I know that a lot of people do want to stay home rather than going into a nursing home, and that a big challenge is finding an adequate caregiver. And so I think, making a field more attractive to workers is a big advantage, and working at home would be much more attractive to workers than working in a nursing home. So that's one point. Yeah, I feel like there must be others. I think anything we could do to get rid of to dismantle large institutions and make everything more equitable amongst us all. I don't know.
I used to make sure I went to the bathroom, whether I needed to or not, so I could look at the medicines in their drawer and what other things, because a lot of people keep their condoms or just if you play the Sherlock Holmes game, then everybody is different. And that's a real rich thing to realize. It's not all hypertensive patients are the same. All depressed patients are the same. There is a biochemical and a social individuality to everybody. And it will tell you a lot about whether or not they will take your medicine, how it will interact with their relationship with their family. If you invite yourself to dinner, invariably you will see if it's a healthy family. And if it's not, then all the medicine in the world, if you don't address it being an unhealthy family, is going to affect their health nearly as much as if you care about them as a human being and how they're doing with themselves and their family.
Mm-hmm.
And it's funny, I mean, I don't know how you do it, Emmett, but, if you're there to see this man who's got hypertension or something, or had a stroke, maybe that would be more realistic. And then you saw their kids crawling on them and how much fun they had with that. That tells you a huge amount, I think. And in the same way, you can watch partnerships, or you see that what are they interested in? What are the magazines on their living room table? So I just treasure the house call as a introduction to a human being. Bye.